Hello, I'm Tanya Nestor and you are welcome to Health Dive Plus. In a world full of diversity, as in different beliefs and values, and the constant improvement of scientific research and technology, we are challenged by the choice of using traditional medicine or modern medicine. Many interesting and exciting claims are being made about two great medical systems, that's the Chinese medicine and the Western medicine. Hello, I'm Tanya Nestor of Health Dive Plus, and we'll be talking about the differences, pros and cons, and finally, common goals of Chinese and Western medicine. Just like any other traditional medicine, the World Health Organization defines Chinese medicine as the sum total of knowledge, skills, and practices based on theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. Traditional Chinese medicine is 1,000 of years old and has changed a little over the time. Its basic concept, that is, vital force of life, called Qi, surges through the body. Any imbalance to Qi can cause a disease or an illness. This imbalance is mostly commonly thought to be caused by the alteration in the opposite and complementary forces that makes up the Qi. These are called yin and yang. It is believed that to regain balance, you must achieve the balance between the internal body and the external element of earth, fire, water, wood, and metal. Treatment to regain balance may involve acupuncture, maxibustion, cupping, massage, herbal remedies, and finally, movement and concentration exercises such as Tai Chi. When we say Western medicine, we're simply referring to clinical medicine, mainstream medicine, conventional medicine, and by way of definition, it is the application of biomedical sciences, biomedical research, genetics, and medical technology to diagnose, treat, and prevent injuries as well as diseases, typically through pharmaceuticals or surgery, splints and traction, medical devices, biologics, and ionizing radiation, among others. Western medicine makes diagnosis through history taking and physical examination, and also by means of large number of modern scientific instruments to check on the body, such as blood tests, urine tests, stool tests, x-rays, isotopes, or computer imaging, ultrasound, and other investigative methods. Doctors make diagnosis based on evidences collected. It is an evidence-based medicine. Chinese medicine doctors make diagnosis by analyzing patients' tongue, spores, and the whole body situation during history taking and physical examination. Diagnosis based on symptoms related to the imbalance of yin and yang rather than the diseases itself. Western medicine treatment directly target the pathogen or etiology. For example, chemotherapy is targeted at killing cancer cells, antibiotics to kill bacteria, immunosuppressants to control autoimmune diseases, or surgery to remove a lesion tissue. Whereas with Chinese medicine, it is a holistic therapy targeted at boosting your own healing power to cure a disease situation. Patients with the same disease may have different yin and yang imbalance. Their treatment may be different even though having same disease. On the other hand, different diseases may use the same method of treatment if they have similar yin and yang imbalance. So in terms of advantages, since Western medicine can directly and quickly remove the cause of a disease, thus if the cause of the disease is clear, it will be effective to make Western medicine suitable for both acute and seriously ill rescue situations. In spite of its fascinating advantages, Western medicine is disadvantageous too. The system of direct targeting of the cause of the disease also get other systems involved, and treatment options tend to affect the system, especially in patients that require a long-term medication for chronic diseases. The dangers of side effects are more remarkable. For example, anti-inflammatory for arthritis diseases also causes gastrointestinal, liver, kidney damages. That's not all. If the cause of the disease can't be found, Western medicine seems to be helpless. With Chinese medicine, it's generally more suitable for patients with chronic functional problems, especially for those Western medicine can't find the cause. Chinese medicine may prevent severe diseases before they are detectable by Western medicine. Hence, with comparison to Western medicine, Chinese medicine, particularly acupuncture, have few and less severe side effects. Sadly, because Chinese medicine focuses on stimulating the healing power rather than targeting specific diseases, its effect is different based on the individual and sometimes takes longer to manifest. For acute and severe diseases, Western medicine is still the first line of treatment. It's quite interesting to find out that both Chinese and Western medicine are aimed at curing the underlying cause of a disease and with similar pathways. However, many differences exist in their approach. Therefore, they may have similar effect in treating certain diseases. In spite of their radically different philosophical assumptions, it is wiser to look upon Chinese and Western medicine as mutually beneficial rather than exclusive. Each approach has ideas and therapeutic methods that can be explained both scientifically and philosophically. Each can benefit the individual, and together they can broaden the philosophical and ideological basis of medicine. In fact, with the development of medicine, the pros and cons of both medical systems are becoming increasingly evident. The formation and development of an integrated medicine will inevitably usher us into a new era of medicine. What does an integration of the two mean for the future development of medicine? That's a question we leave for all those who care about the future of healthcare. Thank you and see you next time in our next episode.